All right, so we're gonna get into bridge position, and this is good for rounding of that upper thoracic spine. So I'm gonna take my bell and I'm gonna put the handle side on the midline so the bell portion's out like that. All right, where we put our hands and measuring sticks, I want the bell kind of lateral to that point. So setting up for a normal bridge, and I can just feel as I lift here, all my weight, it's right on that rounded part. So I like being on a harder surface. That's why I picked the power pad here. It's a little firmer of a pad, so on the floor especially. You really want to squeeze the glutes at the top. And I can push a little harder with that left. And we'll go down for 10, but make sure we get that full extension, that full glute squeeze. Get that breath going too, because you want to tighten, squeeze those abs to minimize any motion at the low back. That's why the bulk of the weight I've got out to the side, so I can focus one glute over the other. This can help correct a lot of imbalances left to right. And then I like to add another after 10. I want to help hoist this up with that. So I'm using that hip thrust to show one more time to pop it up, especially if it's heavy. This is an 80-pounder. And I'm going to hold that bridge now, and I can feel a lot of weight. It feels really good in that upper thoracic spine. This allows my elbows to drop towards the floor more. I can open up the chest big. Part of the reason why we got that rounding there is because the shoulders roll inwards. I want to create this big chest and then train those pecs to work in that longer position. I can feel my left glute really getting tired. So I hit another 10. Then I'm going to do a little sit-up. And I like to put that right there. Just give the body a little break. I can rock out 10. And I'm squeezing. So get those inner thighs wrapping. I'm hugging the bell. Just going to work those hip flexors. And don't even let your body collapse. Let's think. Slowly just tap that mid back down. Come back up. So that psoas, that hip flexion, the abs, never get a chance to relax. We're just doing 8 to 10. I'm going to do that every time I switch. So I did all left side. So now I'm going to bring it up. Let me give you another angle here. So I'm going to load this in the middle. Handle in the middle, I mean. Bell off to the side. And I'm kind of getting it on that outer thigh muscle. It's called your TFL. And that controls that IT band to the knee. So even just the weight digging in there, you can do a little massage. Squeeze that glute. Up and down for 10. Make sure we're tightening those abs. And the hands here are just helping so it doesn't roll back, which I feel like helps me get a lot of weight. So I can feel here, my right side, this is a common pattern with a lot of people, where my ribs are, my shoulder blade, feels almost restricted. So every rep I'm doing, I feel I'm rocking, working, breaking up that restriction on that right shoulder blade side. This is a bit of a mobility thing as well. And I'll show you a little kettlebell trick here you can do at the end to further mobilize. So I'll just say that's 10. I'm going to use that big bridge. We call that a hip thruster. We're really thrusting that in the air. One more time. Thrust. Get it up there. That's the hardest part. Let's see if that's going to feel okay. Hold the bridge. All right, another 10. I can feel that weakness on that side too. Normally I'd say do another 10 sit-ups, but I can also put the bell down. Let me show you it from this angle. And I put my mid back right there, and this might be uncomfortable. So you can always put a towel there if it's too uncomfortable. I got that mid back, that upper shoulder blade area. It's gonna bridge up. Get a couple crunches. I can feel that right side restriction. Probably breathing right into that mic. Sorry about that. That can help mobilize. Foam roller works as well. The advantage of the kettlebell is that's a tough spot. It fits right in between those shoulder blades. The foam roller can't get to. But people develop things like the chirp wheel for that. But why spend the money when you got a kettlebell? And eventually, it's not so sensitive. If it's sensitive, people are like, ooh, it doesn't hurt till you touch it. Okay, that still means there's a problem there, right? That doesn't feel sore to me, okay? And it has in the past, most of my life probably. But now that I've built strength and stability, it shouldn't hurt around the spine, right? We don't notice it until someone touches. That's still a problem, okay? Dr. Klein didn't cause it, just making you aware. And that's the whole thing, is creating awareness. Body awareness doesn't mean to be out of pain, but your body alerts you earlier. Red flags go off earlier before the really big problems happen. So that's good. That might be annoying to some people. They're like, I'm training, I want my pain to go away. And you will, you'll still be functional, but you'll have annoyances. But those are like little red flags saying, hey, go to the chiropractor. Oh, get off your butt, start training.